We'll get started, I think now. We have a number of people who are here with us today. My name is Alice Schmidt-Hambidge, and I'm co-scientific director of the KDE Hub, along with my colleague, Dr. Colleen McMillan, who will join us for the closing as well. And we are pleased everyone is here today for our webinar, The Intersectionalities and Complexities of Anti-Black Racism, Mental Health, and COVID-19. My pronouns are she and her, and we're going to start our webinar today with a land acknowledgement. And on behalf of the KDE Hub, I'd like to begin by acknowledging the importance of the land on which we virtually gather today, and is on the Haldeman Tract within the ancestral and unceded territory of the Anishinaabe, the Haudenosaunee, and the Neutral Peoples. This land was promised to the Six Nations and includes 6 miles on each side of the Grand River from mouth to source. This territory is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement with the Anishinaabe and the Haudenosaunee allied nations to peaceably share and care for the lands around the Great Lakes. Many nations of Indigenous peoples have hunted and gathered on this land known as Turtle Island. I would also like to acknowledge the many people of African descent who are not settlers, but whose ancestors were forcibly displaced as part of the transatlantic slave trade brought against their will and were made to work on these lands. Despite the ongoing violence inflicted on Indigenous peoples and Black Canadians, we're grateful for the care and the contributions made to the land by the Indigenous land and water defenders and Black food growers and farmers. As beneficiaries of this land, we commit in our work and our community to hold ourselves accountable in the continuous work of decolonizing and to begin to meaningfully build and repair relationships and to ensure that we do not perpetuate past harms. I would also like to welcome everyone to this open webinar. And our audience includes project team members from funded projects, so the Mental Health Promotion Innovation Fund, the Supporting the Mental Health of those most affected by the COVID-19 pandemic, and project team members from the CIHR Mental Health in the Early Years projects, and today also our colleagues from the Public Health Agency of Canada and community members interested in mental health promotions. So a couple of announcements. Just wanted to let you know the webinar is being recorded, and the recording will be shared after the webinar. This is a common question we often get. So yes, we always share the recording and an event brief. French translation is available today for today's webinar, simultaneous translation. We have 2 wonderful folks here helping us with that. And we also have a webinar feedback form at the end that we would like to ask you to complete. So the purpose of our webinar today, which is Intersectionalities and Complexities of Anti-Black Racism, Mental Health, and COVID-19. We know that racism is a stressor that burdens the mental and overall health of Canadians and impacts on multiple levels. We'll explore the historical and present-day impacts and disparities of anti-Black racism on mental health in Canada, specifically focusing on the COVID-19 pandemic effects of well-being on Black Canadians. Today, our webinar speakers include our friends from Taibu Community Health Center. So Taibu is a Kiswahili word for being good health. And before we introduce our webinar guest speakers, we'd like to invite you to participate in a quick poll, a survey, with 2 questions that will pop up on your screen. There, I see the questions. So the 2 questions are, how familiar are you with the impacts of anti-Black racism on mental health? And there's a few ratings there. And the second question, how familiar are you with Afrocentric approaches to mental health? So we'll leave the poll up for just a few moments to have to allow everyone to sign to complete the polls. And during this time, I would like to introduce our 2 guest speakers. So the workshop is being led by Lieben Gibran Mekiel, who is CEO, and Solomon Lomé, who is project coordinator from the Taibu Community Health Center. So Lieben, as the first executive director of Taibu Community Health Center, Lieben has led the organization for the past 14 years. He has over 30 years of experience in primary health care, social services, mental health, and community and development capacity building. His educational training is from the UK, in addition to Schulich, Rotman, and Harvard educational institutions. And he's also a fellow social worker. Solomon Lomé is project coordinator for the Amandla Al-Wazi, the Power of Knowledge project at Taibu. Solomon is a public health professional with over 15 years of international experience developing and managing various health, community health, social services, research programs, and he has worked with local and international not-for-profit relief and development organizations and academic institutions, both in Canada and internationally. He holds degrees from England and Ethiopia. Taibu offers health services to Black identifying communities in the Greater Toronto Area and provides national leadership with events and resources. Today, Taibu has strong community roots and has become a recognizable agency that's committed to addressing the impact of anti-Black racism on the health and the well-being of Black communities. And we're so pleased to have you both here today, and please join me in a warm welcome to Lieben and Solomon.
So good afternoon. Thank you. This is a very exciting time for us. We're very happy that we are here with you to have conversation and discussion. And I would like to, first thank Alice and Maria-Alice and the team for the engagement that started quite a few months ago, probably towards the end of last year, at the beginning of this year, and the relationship and the conversation has really been very productive, very useful, engaging, and has led to coming together this afternoon to share some of the knowledge and experience that we have working in the mental health area, COVID-19, and other social determinants of health. So I'm very, very pleased to be here. I'll probably start with the conversation first, and then Solomon will follow, and then we'll take turns. I'm going to skip the first two slides because we've already gone through the land acknowledgement and ancestral acknowledgement. Thank you, Alice, for the reflection. Let me just start by briefly sharing a little bit about Taibu, so we can set the context for people to understand where we're coming from and why are we doing things differently, or the way we do things. It may not be different, but the way we approach things. Taibu as an organization is celebrating its 15th anniversary this year and was established to provide primary care and other social services to the Black community, understanding, when we think about our vision and mission, understanding that, if you move to the next slide, Solomon, in terms of understanding why there is a disparity and inequality happening in the sphere of health and well-being for Black communities. So that's why Taibu was created, with a mission to advance and improve Black health through evidence-based and Afrocentric program and services. And our vision on the next slide talks about, bringing intersectionality, equity-based, and cultural affirming practices to promote holistic wellness, health, education, and prevention. Over the past few years, and then our values are making sure that there is a community driven engagement and initiative. Afrocentricity is very central to our thinking and planning. Obviously, equality and equity also go hand in hand. And it was very interesting to see some of the results from the polls about Afrocentricity and knowledge around African centeredness or Afrocentricity. Our model has, and based on those values, principles, we are beginning to create a framework for how we think, how we plan, and how we engage with our communities with a model of Black health and well-being that has three main pillars and goals, which is around prevention, restoration, and advancement through principles of Afrocentricity, intersectionality, and quality, and then in practice, focusing on social determinants of health, collaboration, and then making sure that the end goal is always about community, advancing community health. So that's the approach that we have. And then how do we kind of try to bring this into practice? If we look at the analogy that we use, it's called the cliff analogy. And if Solomon, you can move to the next slide. And this is, how it helps us to visualize and the rationale behind why are we doing what we're doing and the way we're doing it. So this is a model that was developed by an American epidemiologist called Dr. Kamara C. Jones. And you will see that there are people falling down the cliff. And as we know, with equity issues, there are more Black, Indigenous, racialized people falling down the cliff. And most of the time, systems respond to issues at the bottom of the cliff after people have fallen down, right? You look at who's presenting at the emergency department and why do we have a lot of people with complex diabetes issues coming to the hospital. And then the response would be, oh, we need more hospital services. Maybe we need to do some work in complications. But we never look up and say, why this population is disproportionately impacted. Another example I usually give is community violence. Whenever there's a violence in a community, the response is at the bottom of the cliff and say, oh, there's a community safety issue. We need more police to respond to this stuff. We never look up and say, why do we get here in the first place? And so in our approach, we look up and we say, could we think about some safety nets and maybe catch people as they're falling? Is that something that we can do? Or better still is, how do we stop people from falling down the cliff? Should we consider putting and investing on a fence at the top of the cliff so we can stop people actually falling down the cliff? And then much better would be to move people away from the cliff, right? So the prevention could be around the safety net and the and the fence or the wall there to stop people. But the restoration and advancement is about moving people and thinking about people and promoting health, whether it's mental health, physical health, chronic disease, all those kind of things that we know, social determinants, education, right? Few example is about there is disproportionality in suspension and expulsion of Black students in schools. The disproportionality is significant, right? For example, in the TDSB, we have 12% of Black students representing about 40% of suspension and expulsion. Or 9% of the population in Toronto is Black, but we have overrepresentation of Black children in the child welfare system. Why is that happening? And so how can we move people away for engaging, before they can contact with systems? So that's the kind of thinking that we have around prevention, restoration, advancement, based on all these disparities that is created by challenges faced with communities. So I think we have the questions that were asked around what anti-Black racism is and what is understanding of Afrocentrism. I think this is a conversation we're going to continue to have as we move forward, because these are the two areas for us that drives us, that becomes the lens of how we are thinking about programs and services. How do we engage with our communities? And most importantly, how do we also engage with systems? Because we cannot solve the problem by ourselves as a community organization. The community is not responsible for changing what is happening. It's the system that needs to change. So these are our context when we're coming into the discussion around mental health, the discussion around physical health, the discussion about social health, emotional health, and spiritual health of our communities. moving. Yeah.
Yeah, thank you so much. Yeah, so I will be taking the next few slides. Thank you so much, Liban and the KDE Hub. Yeah, so our initial idea was to pose these questions first and then to look at some of the responses. However, we only wanted to focus on question number 1 and 7, and we will gradually come to the remaining questions while we go through the slides. So, so we left and right here about Black and what's understanding of what Blackness is, or what does Black mean in Canada. I mean, it can have different definitions across the globe, but how do we define and how do we see Black in Canada? So Walcott defines Black as Black in Canada. It's not one thing. It is multiple moments of Blackness. And it has multiple relationship to the nation space, and it is multiple point of arrival, and it is a set of different histories. So it is beyond when we look at someone's skin color and say, oh, this person is Black or Caucasian or Asian or whatsoever. So it has a whole lot of package within it. So this is the working definition that we use for our day-to-day programs and services at Taibo. And looking at what are the theories and how do people theorize Blackness in Canada, this could be an individual experience. It could be reduced to an individual's experience saying, okay, Black means for me this and that. I mean, if I ask each and every one of you, you may come up with different definitions of what Black means. So it could be an individual experience. It may also include a dimension of seeing oneself. And for instance, how do I see myself as a Black person? How do I feel when people are saying that I am Black? So, and then also what the level of my consciousness about what others are feeling or what others are saying about my Blackness. So those are some of, and speaking to ongoing histories, the histories of Black people, their liberation, the resistances that we see across the globe, and how to reshape that identity and how to reclaim it. So those are some of the theories around. You can come up with, again, hundreds of different theories around Black and being Black. So this is just a few descriptions about what it means. And what does the early representation of Black looks like in Canada? And looking at history, I think the very first Black person who arrived in Canada is said to be Matthew da Costa, who I think was used as an interpreter for the whites, I guess. So he's said to be migrated to Canada back in the 16,000. So the history of the existence of Black people in Canada dates back to the 1600, and they have been contributing to the history, the culture, the development of Canada as a multicultural country. And yeah, obviously there are, for instance, things like colonization and racial objectification of Black people that might have prevented to let them function with their full potential. All right, so those are the things that strip Black people back, that hindered their potential, and probably that is what we are discussing today, right? So the racism and other stuff are the tales of this racial objectification, and then the white divergence and things like that. So And what does the current estimate look like in Canada? This is just statistics, and the statistics can change anytime. You may see a different figure. And as you can see, the data that we see here is from 2016. So this may not be the exact figure. So it's just an estimate. In 2016, the Canada statistics says there were something like 1.2 million Black Canadians in Canada. However, between 1996 and 2016, the population doubled. And based on this prediction, in the next few years, this population may reach up to 5% of the total Canadian population. And looking at the statistics further, this is what we see. And starting from early 1920s to 2016, you can see that the population has been growing through time from 0.2% to 3.5%. And where do these Black people come from? As you can see, so they came from over 170 countries, and so looking further into the demographics, here you can see the percentage of the first generation Black people, the second generation, and the third generation. And the majority of these people are found in Nova Scotia. As you can see, during the slave trade, I think most Black people settled in Nova Scotia. The other interesting thing that we would like to share here is the demographic change between migration from the Caribbean and African. For instance, before 1981, looking at the green shaded graph here, there were fewer African immigrants compared to the Caribbean, and almost similar number from the rest of Americas. However, this number grew over time, and now it has overtaken migration from the Caribbean, and therefore from 2011 to 26, 65% of Black people represent, or their ancestors, or they have migrated from Africa. So looking at the intersectionalities. So here we see anti-Black racism as an independent contributing factor to Black health. And then we have a wide list of social determinants of health. And we have Black mental health, and we have COVID-19. So that is why we pose that question: do they intersect? I mean, do they complement each other, or do they contradict? So anti-Black racism itself is part of the social determinants of health. So it has two roles to play. It can play independently or as part of the social determinants of health. And as most of you know, and you work with it, the list on the left-hand side is the widely used social determinants of health, and there are also additional social determinants of health like disability, food insecurity, globalization, immigration, housing, and so on and so forth. So visiting different links, different websites, you will come up with different lists. However, this is very comprehensive list of the social determinants of health that we deal with and that we try to address in our day-to-day efforts. So, so how do we define anti-Black racism? So let me read the definition so that we don't miss the elements. Anti-Black racism is a term that describes the beliefs, the attitudes, prejudice, stereotyping, and discrimination directed at people of African descent. These beliefs, attitudes, and so on are held by individuals and are also embedded in the policies and the practice of institutions, including universities. Liban has mentioned about policing and other institutional actions against Black or other racialized communities. So sometimes anti-Black racism is visible, where we can either defend ourselves or advocate for another person or group. However, in most cases, they are either not visible, or else we just accept as if it is normal and we pass by. So we will come to that. And then anti-Black racism, it could be either institutionalized, like I said, you can boldly see it in institutions like universities, where students do not have equal access to what they need for their education, including consultations or others, or else it is intersectional. So I'm sure you are very familiar with the overt racism and the covert racism. So this is termed as the racism iceberg, or some authors term it as the white supremacy iceberg. So the overt racism is what we usually see, and the covert one is what we don't see, or what we see but what we do not really consider, or else we consider as if it is socially acceptable. So the overt racism is purposeful action or deliberate hatred directed at a specific person or a group. So as I said, it can easily be spotted due to this direct nature. Whereas the covert racism, which is the major portion of the iceberg, is a subtle act which undermines or discriminates against an individual or a group of people. So if I ask you which one is overt, which one is covert racism, definitely we will come up with a whole list of things that you think are anti-racist. But for the sake of time, I think we better move forward. And the second question in the reflection question is about this. So for the sake of time, we will continue. And then in the end, yeah, I will come back, and then Liban will continue from here on.
Sorry, my apologies. I was muted. So thank you, Solomon. We're still continuing to kind of build this context of what, because that's where the complexity lies, right? It's about the impact of anti-Black racism, historical kind of perspective, who is considered to be Black, and what are the challenges that we're facing. And when we're talking about anti-Black racism, are we just thinking about individual prejudices and people's attitude, which has an impact, but it has to be looked from an institutional and a practice, whether it's policies, whether it's things like that, that really bring the challenges and the disparities when it comes to Black communities and their health and well-being. So with that context in mind, if you go back to the slide, sorry, with that context in mind, how do we see this being manifested? If somebody was to ask and say, oh, okay, you know what, and we get asked this question, why do we need a taboo? Why do we need a special kind of attention or focus that addresses the Black community? And I've mentioned some of those examples, but there are some systemic issues that we begin to see when we look into the situation. I've talked about the suspension and expulsion, and you could look at any health outcomes, social location of communities, and you will see time and again, wherever we have local data, which we don't have as much, but wherever we have data, you can see that the Black population and the indigenous population are always at the bottom of the ladder when it comes to health and social outcomes, whether it's health, mental health, criminal justice, education, employment. There are so many manifestations of anti-Black racism that we don't have time to go through that, but I just put out here a few. When we talk about police harassment and brutality, you can see the disproportionality of what is happening in this case. I've spoken about the suspension rates. If we talk about employment, you would see that the the Black unemployment rate in Canada is twice the national average. And I don't know if many of you know the story of John Rivers, who a Black rapper, who took him maybe, I don't know, 4 or 5 months before they could find what exactly was going on with his situation, because every time he presented himself at the emergency department, he was considered to be, seeking pain medication or fixes, and was never treated in the right way, and not the right assessment was done. But it was only through advocacy that he was able to get this. So there are so many barriers and system barriers that exist. And this is why we know the manifestation of anti-Black racism on the health and well-being of Black communities. Solomon, if you could advance. Other examples would be, and we're talking about mental health, for example, and you will see in this slide, people of Caribbean, East and West African origin in Ontario have 60% increased risk of being impacted by psychosis. 60%. And the rest you can also see, whether it's poverty, and there is another statistics that I don't see here. I think there is the Black women and the diagnosis of cancer. You look at HIV infection, you will see that in 2015, 60% of new HIV diagnoses were with Black women. So there are significant and very difficult disparities that needs to be addressed. And then it's the same thing with mental health. We've seen some of the data, but we know also that it's not just the disproportionate rate of mental health, but also access to mental health services, and most importantly, the availability of services that cater to Black bodies and Black minds in a culturally affirming way is also a big challenge. There are some other reports that I could share with you. For example, there's a study that was out of the UK, was titled "Big, Black, and Dangerous." And if you were big and Black, you were deemed to be dangerous when you entered into a mental health institution. And so the likelihood that you would be in forensic sites or secure site is very high. It's the same thing with engagement with police, as we know. If you can move to the other. So now, with all this background, COVID happened. And when COVID happened, we were already hearing from the states who were being really impacted by COVID. And so a few Black health leaders here in Toronto started an advocacy movement requesting the public health unit and government to start collecting race-based data. After quite a few advocacy engagement, public health started collecting race-based data around COVID incidents. And, because of that, we are able to see here, for example, the impact of COVID-19 on various communities, as you can see. This was taken, this was a report that came out in May 2021, but there was a report that came out in September 2020 that showed while the population of Toronto, Black population, Toronto is only 9%, the incident rate was 24%. So, 4 times higher, or 1 in 4 were impacted by COVID. Because of the strategies that came out of that report in September, and the work that happened because of the city's focus on racialized population and COVID, the FSAs, and looking at communities that were most impacted, we could see that we were able to reduce the incident of Black communities from 24 to 14%. But then we know also the reason why this was happening. As many of us were on lockdown and we were able to work from home, many of the Black communities, and because of their nature of work, were not able to work from home because they were in healthcare, in hospitality and things like that. They had to travel to go to work. They couldn't work from home. And so there were so many challenges that people were facing. And we always say here at Taibu that COVID really did not create these disproportionalities and disparities, but acted as an X-ray and showed us that how generational disparities have been exacerbated by a pandemic such as COVID-19. Moving forward, yeah, so I've already spoken about this in terms of historic injustices, and these are some other data that have come out to show that the Black community was and is still impacted by COVID-19. And we have always been saying that when engaging with government or policymakers, and we're talking about recovery, we have to make sure that recovery is not going back to where we were before the pandemic. Because if that is the case, then actually we have really not done anything. But recovery has to be in a place where, because we know now and we have evidence that Black communities and indigenous and other racialized communities are impacted differently, we should recover to a better place where people are much better before the onset of COVID-19. Again, high losses of job and unemployment rates and other stats that you can see here. And you can see how this is, even compared to other racialized groups, the Black community is really not doing well. These are other numbers that we could show you. This is the mortality rate for age standardized COVID mortality rate in Canada, and this is by sex and racialized groups. And you can see that the numbers speak for themselves, and particularly with Black men. And then, with regard to income, the next slide would show you again how not only because Black people, but because also of the low income status, the impact has been significant. So what are we trying to do here at Taibu, considering all this and at the bottom of the cliff, and how can we move things around? So I'm just going to share some of the things that we do, and then I will pass it on to Solomon. So on a very strategic, high, 30,000 feet kind of a space, we have been doing some work around advocating around Black mental health, but also advancing positive Black mental health position through our the Black Mental Health Day or Black Mental Health Week now, a partnership with the city, where the first week of March is now designated as Black Mental Health Week, and we do a lot of engagement, education, awareness, collaboration throughout the city, but has taken now also in other cities, including Ottawa, the city of Brampton, nationally, elsewhere as well. So those are the kind of things that we're doing. We are the lead agency here in Scarborough in leading the Toronto Community Crisis Service. This came out of the painful death of Regis Korczewski-Paquette, whereby the police responded to a mental wellness check and led to the death of this young Black Indigenous woman. And so we worked with the city to get an alternative way of addressing mental health crisis and mental wellness check. And so now there is a non-police-led, community-led crisis response throughout the city, and Taibu is leading the service here in Scarborough. We also are part of a provincial mental health service around substance abuse for African, Canadian, and Caribbean youth, a program that has existed for over 20 years, but now collaboration with other organizations throughout the city, as well as in Hamilton and Ottawa and Windsor, Essex, providing culturally appropriate and affirming care for young Black youth. And then we also do work differently, as I was talking to you earlier on about systems change and engaging the systems to bring about change, is we have 2 or 3 now projects where we are working with systems. For example, the Kaya project is a project we're working with Children Aid Society of Toronto and working with Black families, either to prevent them to get into a system, but for those who are in the system, providing the wrap-up support so that they can come out of the system. And the same thing, we're working with the Ministry of the Attorney General around working with people who have low and medium offenses and providing them wraparound service so they can get out of the system. So those are the kind of system changes work that we do. And then we do a lot of capacity building training for our organization. And one of the things we do is, related to mental health and Black people is addressing the anti-Black racism, impact of anti-Black racism in the workplace. We have developed a documentary called Working While Black, and we take this to various places and spaces for conversation, discussion around the impact of anti-Black racism and what can we do as Black people to keep insane in a works environment, or also providing guidance and support to organizations in addressing anti-Black racism. This is another project around young Black mothers, a research project that we have developed and working again, addressing the barriers that prejudice and barriers that young Black mothers face through their navigation of the system. And that's also another kind of a policy recommendation and funding recommendation that we're working with. We have developed, and I see some questions around the Working While Black. I'll share some thoughts there. The Afrocentric healing circles. We've developed resources for people to understand what Black mental health healing circles look like. Why does it have to be rooted in traditions and rituals and beliefs? And so that people can do that and support Black communities. And this was a project we developed with Bell Canada. I'm going to pass it on to Solomon to talk about the biggest project, and the best project, I think he would say, Amandla Olwazi. Thank you.
Yeah, thank you. Thank you very much. Yeah, so now I'm going to focus on my baby project, which is the Amandla Olwazi project. And I think Mary has mentioned about this project at the very beginning as part of what I am currently doing. So the project that I'm currently managing is called the Amandla project. And it is, again, most of the names of the programs and services that we provide at Taibu have historical names. So Amandla Olwazi, as you can see from here, means the power of knowledge. And as you know, power changed the world, right? So modern civilization is the result of knowledge. So that is why if we gather knowledge, that will give us power to act or to respond to the existing or emerging needs of the communities that we serve. So that is the Power of Knowledge project. And what is it? Why do we do it? How do we do it? And that is, I will be taking the next few minutes to talk about this. And what is it? And this is, we repeatedly mention about Afrocentric values and the principles, Afrocentric approach. We have a reason because we have seen the results when we use Afrocentric approach, given that we are serving the Black communities in the Greater Toronto area and other racialized and the general population within our catchment area. We have seen some results. That is why we wanted to make Afrocentric the center of our practice. It also raises awareness of the impact of anti-Black racism. Now, given that we have got a snapshot of what anti-Black racism is, this project tries to increase the awareness level or create an awareness around the impact of anti-Black racism on the mental health and the well-being of Black Canadians. Although this project is implemented by Taibu, it is a national project. It's a national knowledge mobilization project, and and it builds on existing research around anti-Black racism. And it didn't just come from the blue. So it is based on knowledge. It is based on knowledge, creating more knowledge, to create opportunities to act. So that is where it is embedded. And what are the objectives? What do we want to achieve in the end? You know, projects are always time limited. However, during the lifespan of this project, our very first objective is to synthesize knowledge. We have been doing this from the inception of the project, and in the near future, we are going to publish a manuscript, which is part of our literature review process. So that's what we do. And we believe in stronger collaborative partnership. That is how we came up with partnering with the KDE Hub in Waterloo. And we have several partners and the stakeholders who are being involved and engaged in this project across Canada. And we connect diverse Black community members with Afrocentric knowledge products. We have started producing these knowledge products, and we have also created a new website for an independent website for this project, which will be launched within the next few weeks. And we are going to host all the knowledge products we develop on this website, and most likely on the website of our partner organizations, including the KDE Hub. And then, yeah, we develop Afrocentric knowledge products, and then we mobilize knowledge. We are not just producing these tools and keeping them aside. We want people to use it. Not only the knowledge tools and product that we produce, but other which are being produced by the members of Black Mental Health Project across Canada. So we gather all these resources together and then host it on our interactive website. So keep an eye on our website, and you will see most of these knowledge products there very soon. And
Solomon,
yes,
so
please.
somebody's asking about, I think, how to get to your website, and I'm assuming the question from Tanya is, do you have the name of the website at this time?
We have the name, but it's not yet live. So once it is live, I'm going to share the website with Mary or any member of the KDE Hub team, and then you will have access to it. So what do we expect? One and foremost is reduced impact of anti-Black racism, reducing this impact, reducing the anti-Black racism itself. We reduce the impact it has on the mental health and the well-being of the Black Canadians. So that is one of our expected outcome. And then we always want to impact policies and the practices and the system change, not necessarily in the GTA, but throughout Canada, based on the knowledge that we gather, the synthesis. And yeah, so with that, we want to we want the policy to be improved and sensitive to the questions that is being raised by the community. And then strong networking. Again, we believe in networking, and you do, because there is a saying that unity is strength, right? So the more we network, the more we come together, the more we achieve, and the more we can address anti-Black racism and other social determinants of health. And then these are the research questions we use to conduct the literature review. I have mentioned about the manuscript which will be coming out of this literature review. The first four are the ones we started with, and the fifth one about Afrocentrism is because we engage the community from time to time, and we hear what the community tells us. Then based on that, we wanted to add this ingredient into the literature review. So the literature review and the manuscript is answering these 5 core questions, and I promise you will get a copy of the manuscript for free. So what does Afrocentricity looks like in Canada today? Is it just theory, or is it being practiced? And for this, we always consult our mobile libraries. Our mobile libraries are our Black elders. So this is a response from our key informant interview that we conducted across Canada. So what is Afrocentricity, and we started with the definition. How do you see it? So the response is, it is one's culture. It is something that is embedded into one's culture or identity. So that is why we always say, okay, to design and to implement a program or service for Black folks, it is always important to consider their culture. So yeah, that is it. And then unity and the spirituality, it is something that united these people. I know there are always diversities among the Black population, be it geography, be it language, be it culture. However, they still have things in common that make them one, right? So it is a way of expressing that unity and the spirituality. And I don't want to read the entire quote from the participants. So why do we need it from the participant perspective? Okay, why do we use Afrocentricity or Afrocentric approach in our day-to-day? So this person says, knowledge or science and its methods of investigation cannot be divorced from people's history, cultural context, and the worldview. Almost all knowledge has cultural relevance. So that is why I'm repeating the same thing that I said a minute ago. So that is why we use Afrocentric approach to serve our Black folks. And I think at any forum, at any stage we get, we promote it, we share our success stories. So we have seen the fruit of using the Afrocentric approach. So it is scientifically suggested or scientifically recommended to use Afrocentricity while working with the Black communities. And manifestations of Afrocentricity, I will, so how does it manifest in your day-to-day work? How do our elders, how do our Black folks exercise or practice Afrocentricity in their work? So some of the suggestions they gave are art, Black feminism, and the spirituality. So these are repeatedly recommended. The use of art is part and a parcel of Black history. For example, this person is an artist, and she's telling us that she uses Afrocentricity in her day-to-day artwork. So they have also suggested it is a way of Afrocentric way of sharing knowledge, is also using ways of expressing their feelings, their expression through artwork. So those are some of the things suggested by our Black elders. And then connection, solidarity, unity, and organized actions. So you see people, particularly during the summertime, when they come together, for example, as they either create a home country association, or the kind of, there is what we call, in our culture, there is what we call ICOB or ITER, where it's a kind of social safety net networking. So people come together, and that gives them that kind of unity and reflecting their own culture and identity. And how do you share it? Yes, storytelling is the most frequently used method of sharing information in an Afrocentric way. So if you greet a Black elder, they usually start with telling you a story. So again, that is something that has grown up within Black people for generations. Intergenerational interaction and information sharing. So this is what we want to mobilize now, because there is a kind of generational gap between the elders and the middle age and the young generation. So we want to bridge that gap so that people can have or can express their feelings among different generations. and the framing Afrocentric way of knowing knowledge, mobilization or sharing, community conversation, which is basically a part and parcel of what we do, right? Whenever we develop programs and services, we consult communities because the ideas that come from them, if it is included in what we design, it is more helpful. So that is why we listen to them. And then again, this is the suggestion given. This tells us that nothing without us about us, right? So they have to be, they want to be part of the conversation. Then someone said, listening to learn. So, and his conclusion was, he said, okay, if you are there to listen to learn, you will learn something. But if you just want to reply to what someone says, you are just thinking about what should I say in my next conversation. So it is very important to listen to learn. That is what we encourage our youth and our very young generation to listen to their ancestors. And as a common practice, what does it look like? Yeah, it's not as we expected. So the elders are saying there is some potential if we unite and if there are ways of bringing these people on one stage, be it in a small group or large group, there is a potential. But they told us that there is much more that we need to do. We are people of African heritage. We have shared experience. This is exactly what I said earlier, right? So there are diversities. However, there are more similarities than the diversity. So since you will get the slides, I think you can read through some of these interesting quotes. And how do we promote or use Afrocentric way of sharing knowledge in Canada, given that the suggestion given is it is either weaker or close to non-existence, shared sense of knowledge, mobilization, and the consciousness. And yeah, I think the only way you can overcome that is by having people from the Afro community and diverse community become part of the service to Afrocentric people. So if you go to any institute, for instance, a few months ago, I came across one person who is a Black person and who doesn't have a family physician. And his response was, I don't have someone who is similar to me. And then I said, what do you mean by similarity? And then, of course, yeah, a Black person. So if some service providers are from these communities, the service utilization or the service uptake will definitely increase, and the people can freely express their needs, right? So that is what our participants from Manitoba mentioned. So yeah, you will hear similar stories if you question people, Black people. And talking circles and group therapy, I think we have plenty of these talking circles within Taibu for young people, for the elderly, and for others. So they strongly believe in talking circles because when people meet, as I say, they share a story, or they start with something from what they faced here or back home, and then the conversation continues. And that really immerses them into something and helps them to focus to that particular topic for that moment and helping with healing and health. And practicing to learn again, listening to learn came back. So yeah, and I will hand over to Liban to conclude this presentation. Thank you.
Oh, thank you. Thank you. And I'm just going to go very, very fast so that we can have more conversation and discussion. And so we've looked at some of the knowledges and that we are using in terms of our thinking and engagement with communities. And there are a couple of things that, I want to kind of also make sure, as we talked about earlier on, when we are addressing anti-Black racism, whether it's mental health, physical health, chronic conditions, any kind of things, we have to move from the kind of personal space. There is a value to do that, but I think we need to move from the personal to the institution and the structures. And when we do a lot of training with different organizations and institutions, and you know, hopefully this is also something that we really want you to kind of take away when, you know, from this engagement, is that we do a lot of personal reflections. We all have prejudice and assumptions and stereotypes. We all do, whether we know it or we don't know it, we all do. I hold certain prejudices and privileges and stereotyping about Black people myself, right? As a Black person, it all depends on the environment that we grew up, the information that we had access to, the interaction that we've had or not have, the lack of education information and stuff like that. It's always good to do that reflection and saying, okay, what do I know, and where is this coming from, and just making sure, and then using that to move into, so now that I know those kind of things, what are the changes that I need to be thinking about? And so we have developed a pathway. We call them the 4 A's. And it's, you know, yeah, if you move, Solomon, to the next slide, we call them the 4 A's, and they are acknowledgement, accountability, advocacy, and ally relationship or allyship. These are the kind of 4 pathways. We call them the 4 ways, or the pathways towards change. The first is to really understand and acknowledge that racism exists, definitely, but in our conversation here is that anti-Black racism exists. And you will be surprised how many people really do not really think or believe that racism exists in Canada. So I think, or the usual conversations and dialogue I hear is that, oh, thank God we're not like south of the border. You will be surprised, and the data speaks differently. So I think we need to acknowledge and say there are systemic issues. We know it exists. And so that's where it starts. And then now that we know, and because we see all this manifested in these disproportionalities, why is the Black community 3 to 4 times more likely to be diagnosed with diabetes or HIV, or what are the overrepresentation of Black people in mental health institutions or criminal justice, and the disproportionality in education, all those kind of things. And then to say, okay, now that I know those things exist, I have to develop some accountability to make sure that I be part of the solution. Whether I'm an organization, I'm a decision maker, I'm a provider, all those kind of things, is to bring it back to ourselves and say, what do I commit to do, and creating that accountability. And who's going to check this, right? As decision makers and who hold power, like Taibu holds power because we make decisions, how do we become accountable to our communities? That's going to be very important. And then the third process, or the 2 other points are like action oriented. We need to be able to voice the concern of marginalized voices, Black voices, Indigenous voices, because they're not at tables where they can, or are they not empowered to bring those voices. That would be a one kind of a temporary move to say, okay, now that I know, and I'm going to make sure that I'm going to be part of the solution, I'm going to raise the voice, or I'm going to be the voice of those communities. But it should not stop there. We have a responsibility to empower those marginalized communities, in our case, the Black community, to make sure that they occupy the spaces, so they are providing their own voices, or they are raising their own voices, or they are amplifying their own voices. And that's where that ally relationship is created. Next slide. I think if there is one slide, yeah. And you can also advance it again, one more, Solomon. So we all know about community engagement. And community engagement is a spectrum. I will tell you, in my conversation with big institutions, whether it's the ministry or funders and health service providers, we are very good at the first 3 areas of community engagement. We're very good at informing people and say, okay, you know, here is information. And we call that community engagement because we have informed communities. Or We say, okay, we want to hear from you. And then we do consultations and surveys and stuff. And then we say, oh, we've done community engagement. Sometimes we involve them if we are good at what we do, but very seldom do we collaborate and, most importantly, empower communities to be their own change makers. Very seldom. So I think moving towards the spectrum of collaboration and empowerment is a lot of work that we need to do. And we can see another model that is developed by the Tamarak Institute is, who's doing it to who and by who and with who. But as the Afrocentric principle that we uphold, for example, is nothing about us without us, or the principle of self-determination is what we work towards. And we don't have time to share some of the information that we have, but many of our programs are developed by the community members and facilitated by them and decided by them. And so we need to move, if you advance the slide, we need to move towards that spectrum. Oh, sorry, we need to move to that spectrum. No, move it backwards, Solomon. We need to move to that circle where it is about empowering communities and not just working with them, but building the capacity so they are determining the way that they want to receive services and participate in the service delivery, in the planning, in the evaluation of the services. And that's where I think this nothing about us without us, the principles that we talked about, or if you go into indigenous spaces, indigenous health in indigenous hands. That's the kind of model that we have to use. And we do that. We work with indigenous communities. We receive funding from the government. And we said, it's not, we are not experts or we don't know anything about indigenous people. And we have to follow the principles of indigenous health and indigenous hands. And we created an advisory council. They make the decision around indigenous programming here in Scarborough. They decide how they want to manage their budget, what services needs to be done by them, for them. So when we're talking about anti-Black racism and addressing issues within the Black community, understanding the historical generational factors, acknowledging that there is a huge disparity around accessing, impacted by mental health, but also accessing mental health services. Making sure that we're not just opening doors for services, but the services themselves are culturally affirming through some of the examples that we shared. Very quickly before I stop here, when we engaged with PHAC around our knowledge mobilization project, the presentation we made was knowledge mobilization is very easy. I mean, I'm not gonna share this with you guys. You are expert around knowledge mobilization, right? You create resources, you have your things, and you make it available for people in an engaging way. That's very easy to do. We told them we want to do it in an Afrocentric way, which means the resources developed have to be engaged with not only the project members of the projects that were involved in here, but the elders, as we said, bringing the voices of the ancestors and the traditions and the rituals, whether it is in arts, whether it is in singing, whether it is in storytelling. That's the kind of work that we want to do. And this is the kind of thing that we also want others to be able to do by engaging, by collaboration, by partnership, by knowledge exchange, that as we are doing here. So I'm gonna stop there and allow for conversations and discussions as we go into our next step. Any questions, comments, feedback, things that you didn't agree with us? We take everything right now. Or affirmation. Come on, something.
It looks like Kimberly has her hand up.
All right.
Had Kimberly.
Kimberly, we can't hear you, Kimberly, if you're speaking.
Sorry, I forgot to bring my microphone down. I work at the Provincial School for the Deaf in Milton. And the biggest challenge I find with us, as you were indicating, nothing for us without us, in the deaf education field, it's always hearing people, meaning people who aren't deaf, making all the decisions. And so when you have a student who is deaf and also Black or also Indigenous, those multi-layers come into, it's an extra. Not only that, but because hearing people have made the decisions for so long, even nothing for us without us, even if involving sometimes that they don't even know, they don't have that education foundation. So it becomes this multifaceted challenge, and sort of where it comes to priority, well, let's get them educated first. And, you know, and there's a lot of systemic issues out there in the boards as well, but I just find it so challenging with the population here too, with that, when they have that added
Yes.
piece of oppression.
Yeah.
So it's sort of like,
Thank you.
I don't know, suggestions, maybe just
No,
opinions.
but
Yeah.
yeah, no, thank you very much, because we didn't even have time to, we didn't even touch the intersectionalities, right, that exist. And that is a significant other layer that is added, right? So, and people who didn't have a voice for a very long time, for generations, just saying, okay, we're opening this forum and come and do this is not going to work, right? That's why the collaboration and the empowerment is very important. They need a lot of not just education and stuff, but also you know, creating some kind of a space for them to build that capacity to be able to say, my voice matters. Because a lot of people, if people have been ignored for generations, they don't believe that their voice is going to be mattered. So how are we going to genuinely engage them to make sure that that is there? Plus, are we going to change some of our formats of engagement? That is also going to be a very important thing, right? We say, oh, let's create this patient advisory group here, or this group here to advise us. And then we create the same system that we have, this box. Okay, we're going to have a meeting, and this meeting is going to be between 9 and 5, right? And for many grassroots marginalized communities, maybe that's not going to work. We may have to find different ways of doing that. And for us to find what works for them, and then creating that space for them to be able just to open a door and say, we are including you, is not going to work. And then, as you just mentioned, Kimberly, is if then there are other issues, you know, whether it is ableism, to SLGBTQ, you know, you add any other layer on top of that, it's going to be very challenging. So we have to understand that and work towards that. That's a very, very good point. I appreciate that. Thank you.
Yeah, and just one more thing to add, we also have the term autism, which means viewing hearing people as superior to deaf. So that's another ism to add,
Yeah,
unfortunately. Yeah.
Very complex. Yeah, thank you. Thank you for sharing that. And thank you for the work that you do. Christine, I see your hand up.
Hi,
Good to see you.
everyone. My name is Christine Soon. I work with the Mental Health of Black Canadians Initiative at the Public Health Agency of Canada. So first off, Solomon and Lieben, thank you for this wonderful presentation. I just wanted to say thank you and appreciation for your leadership for addressing anti-Black racism and all the great work you're doing in the space of, you know, connecting, building in the community and knowledge mobilization. My question for you, I was really interested in seeing that continuum that you share, that visual in terms of moving from inform, consult, involve, collaborate, empower. And I have seen that model from Tamarack as well. How, from your perspective, how can we as a federal funder support community organizations such as Taibu and others in kind of moving and shifting along that continuum towards empowering and kind of building that you know, sustainability factor in when we're working with community-based organizations?
Yeah, very, very great question. And I think a great opportunity for systems, particularly funders, right, to direct certain things. You know, we all know who holds the money, holds the power to influence. And so I think that is a very good thing to direct people who are working with communities and say, is there a plan to, you know, like, yes, there is a plan to collaborate, and like we know the language of involving participants and communities in data, right? So maybe we can be a bit more specific or giving some guidelines to say, and here is where we would like to see that engagement. Because I will tell you, once you engage communities at that level of active participation and empowerment, that's when sustainability happens. Let me give you an example. We have developed this seniors engagement strategies called the Ubuntu Village Project. And we started a few years ago. And the idea is, in traditional African-centered ways, there is no social services, there is no this service, that service. In a village, it's the village that takes care of the village. It's the neighbors that take care of the neighbors. And there is a principle called Ubuntu. Ubuntu is the South African Zulu concept that translates as I am because we are, or I am who I am because of who we all are. There's no individuality, there's only a community, right? So we have brought in that concept and that value and that tradition and principle and said, what if we created a virtual village here of Black racialized seniors? And so now we have very engaged seniors that do programs by themselves because we build capacity. There is an Ubuntu Ender Council. They decide on what programs happen here in Scarborough for Black and racialized seniors, what events is going to happen. They've even taken over some of the events that Taibu was used to plan and host because they saw that we were not doing it right and we were just scrambling. An example, I feel a little bit shame when I say this, but good feeling of shame here. We are a Black organization and we should be like on top of things to develop and host Black History Month event. And our Black seniors who were very active in the community and at Taibu saw us scrambling to design a Black History Month event in January. Right? We just realized, oh my goodness, it's February next month, let's do Black History Month. And then we would have a good event, but they came to us and they said, can we take over hosting the Black History Month? We want to help you out. And they started planning in October. All the details of the program is finalized by November. Flyers are ready by December, and everybody knows what's the date. Nowadays, actually, when we celebrate 2023 Black History Month, we know the date of 2024 because the seniors have taken over that. When seniors or communities are given the space, the right amount of support, capacity building, they take over. And that's how it becomes a sustainable, rooted, not program, but initiatives. It becomes theirs. And so there is already models that we have created. And so that is because we moved to the collaboration and empowerment space. And we as an organization said, we're not going to make any decisions. We had to learn not to make decisions about seniors program. We had to think carefully and said, no, we have to give our power to them, right? So institutions also have to change. And, for us, we have said, if it's not got any legal risks or health and safety risks, why should we make a decision about seniors at Taibu? They should make this. So we had to learn to change things for ourselves as well as an organization. So funders could say, we need a plan around community engagement, and community engagement, not the buzzword, but making sure that it moves towards collaboration and empowerment. And that way, and with appropriate resourcing from funders, and that way it remains in the community, whether funding is there or not, or funding changes, the community is going to be responsible to do that. And we see how organically, we don't have issues with recruitment and stuff. All the seniors are doing that, and because they know this is not about a program, this is about them, their participation is active, genuine, and fulfilling.
Thank you.
So it looks like Annette has their hand up as well.
Oh, thank you, everyone. Is my mic working?
Yes.
Yeah. No, thank you so much. It's been a pleasure attending your presentation. It's a lot of information you have shared. And I was just wondering, she and her are my pronouns, and I am the mental health promotion coordinator at Moyo Health and Community Services.
Mhm.
And I have two questions. The first one is, what steps are you taking to address the mistrust between Black communities and service providers who are not Black? I think in your discussion you hit on it, like one community member did not have a family doctor, and they said they wanted someone who looks like them, another someone who is Black. But we shall not achieve that. We all know that we cannot have exclusively Black service providers. So what are steps are you taking as an organization to address that mistrust? And the other question is, how are you dealing with the conflicts of meeting the requirements or the demands of the funders versus the realities of the communities you're serving? Sometimes the funding we get and the goals from the funding, the theories on the paper, as per what the funder wants to see, are totally off to what we really want to meet with our community members, or what we want to present to them, or their feedback on how they want to be served. So how are you dealing with those two conflicts? Thank you.
I'm going to pass the second question to Solomon because I don't want to answer that question when Christine is here. I'm joking. Solomon, you want to answer the second question? I can answer the first question.
Okay, yeah. So meeting the funders' requirement, is that the question?
Yeah.
Yeah.
When sometimes it's not like what community wants to do is not aligned with what the funders is trying to do.
Yeah, basically, I think we have tried to touch base this. I mean, both of us, myself and Liban. I mean, when we design programs or services, our very first step is consulting the community, right? Because they know the issues that affect them more than we do. We are just there to organize the services and then provide in a timely manner. So that is our role. We just play a facilitation role there. Otherwise, we are not there to make decisions on behalf of the funder and saying, okay, this is what we got, this is the money we have, this is the service that we can provide, go with this. So the most important thing starts from designing the program, where we engage the community members. And then based on that, we request funding, right? I mean, that may not be always the case. As you said, yes, sometimes it may not align. However, those are some of the ways through which we address or through which we reduce those gaps. Engagement, involvement. That is what I can say, and probably Liban can.
Yeah. So, I mean, at the beginning, making sure that that is well received by the funders. And also, there are times when negotiations are required with the funders because, it's about bringing about a different change. So we do negotiate and we speak with our funders and kind of work through that to say, no, this is very important from community's perspective. Here is the model. Here is the principle. Here is why it's important. And so having those negotiations is very important. And we also have learned, at least in my experience, things are changing. COVID, George Floyd, Black Lives Matter movement have brought in some new perspective in philanthropy in addressing, in doing funding and project management and stuff like that. So find an opportunity to bring a case and providing that information to funders for engagement and consultation. But I think, as Solomon said, if from the very beginning those pillars are very clear, you can always refer back and say, here is how we approach this, and this is why it is important, and that's why we should continue to do this. So that's not question number 2. Question number 1 is very, very important.
Yeah.
Without trust, there is no relationship or no services, right? And I will tell you, when Taibu started 15 years ago, the direction that we had from our founding members and our board, the direction I was given was build trust with the community. Even as a Black mandated and Black led organization, we had to work hard to develop that relationship. We were new. Nobody knew Taibu. Taibu did not exist. We're coming into a new neighborhood. You know, so how do people approach that? So we really took time to develop relationship and not focus so much on programming and stuff like that. It worked very well for us. I know today, at least I don't know if Solomon would agree or other staff would agree or my board I agree. If there is anything that we have done really well is developing relationship. That is important even as a Black-led organization. That's why when people come in, they feel this is the space for them. This is their organization, not just an organization they go to receive services. You know, they tell us off when they're not happy, and they're very, very open and genuine when they're not happy with our services, which is great. The other thing is also we play a critical role now that as an organization that is trusted by the community for who we are and what we do. And then when we are really building relationship with other institutions, we make sure that that relationship is also part of our engagement process. And anything that may feel or seem to impact the relationship we've developed with our communities, we're very careful. And we're very honest to say, we can't do this. Or when people are coming to us to say, we want access to communities, can you help us? We make sure that there is a very open communication as to say, this is what is going to happen. This is our role. But you, as an institution, have to make sure that you are also trusted, because we will not broker the trust. And if something goes wrong, we don't want to lose the trust that we have. So we play that role. And the other piece that we do on the third level is doing this kind of engagement and training and, you know, for other institutions, if for them also to understand where Black communities are and the sensitivity in approaching that. So they now can help themselves to be able to develop that relationship. A very good example is during COVID, you know, there was a lot of issues around access to testing, even understanding the seriousness of COVID. There was a lot of misinformation, there were a lot of myth, cultural views, and that came out of a generational and historical challenge between healthcare institutions and Black indigenous communities, where there were a lot of abuse that has taken place through clinical trials, right? As recently as 1970s with the Tuskegee experiment in the US. And so we had a big role to play to make sure that, number one, our communities understood that this was real, that the virus is real, and Black communities are disproportionately impacted by COVID. So we had to do a lot of communications and awareness sessions. We worked with the City of Toronto in the establishment of the Black Scientist Task Force against vaccine equity. So they could go and do a lot of education, engagement, discussions, town halls with Black communities. And then when the vaccine rollout took place, we made sure that we were a vaccine space here for Black racialized communities, so that people can trust the space, they are comfortable, and they can come. They can come to ask questions if they didn't want to take vaccines. And we worked with the Black Physician Association and with our local hospital here to make sure that all the vaccinators were Black and racialized. So people who came in and they saw themselves reflected, so they were comfortable in asking difficult questions. And they would go back and then come back and ask more questions before they took the vaccine, right? All the staff being represented, the nurses, so people can engage and create a safe, right? So organizations have a responsibility to make sure that that trust is very important. And we also collected data, and we knew that we were serving the Black community and racialized communities because we knew who was coming in and who was not coming in. And we would do targeted outreach in churches and in mosques to make sure that we facilitate the access of essential services to Black and racialized communities.
Thank you.
Yeah,
Vivian
I think,
Solomon.
yeah, that's also, I think, linked to what Christine raised, and I think the most important thing is, I mean, to bridge the different barriers between the community, the service providing organization, and the funder, right? If there is proper and a clear information flow, and if there is some kind of flexibility between these three levels, I think it makes it easier for, I mean, be it Black or other racialized communities to utilize our services. And yeah, having those kinds of flexibility when it comes to funding, for example. I mean, I know sometimes the time may not even allow to say, okay, what do you have, or how do you want to approach to this issue? Sometimes, okay, there is this money, and we want you to do this, and that. And for us, the most important thing again is to go bottom top than top bottom. So I think, yeah, it is all tied together. Yeah, thank you.
I had the difficult task of bringing this presentation to an end, and it's so obvious that there are more questions. I know I see a question in the chat from Tanya, and I don't know if we got around to it, so perhaps she could email it to you both, and she was asking about different models. But it is 3 o'clock. I want to respect your time, and I had like I said, the difficult task of how do we bring this discussion to an ending. And so I'm going to do it quite simply by just saying a sincere thank you to both of you, Liban and Solomon, for your presence today, for the rich discussion, for the sharing of the Afrocentric principles with us all that we can take with us into our work. And also you mentioned a word that really rings true for us at the Hub and everyone who is in this webinar today, and that is one of partnership. So thank you for that. And that is a real privilege for us to have with you both and with Taibu. So thank you. Just two housekeeping tasks for everyone who is with us today. The recording and the slides and the event brief will be sent to you in a couple of weeks. So please look for that. And when you exit the Zoom, there are 4 questions that we are asking you to do. It's a very short survey. So if you could please answer them for us, we would always be appreciative. And we thank you for spending the last hour and a half with our guest and with us at the Hub. So enjoy the rest of your afternoon, and we look forward to when we will meet again. And there goes my light. So I guess that's a cue to say goodbye.
Thank you.
Thank you very much for the opportunity.
Mm-hmm.